Hi, this is Dr. Kang's scuba diving stories about the cancer and diving, chapter 2. And last time I gave you the briefing on cancer and cancer effect on diving. But today I'd like to give some information on individual cancers are very closely related to diving. So I cannot cover the whole cancers, but these are relatively and very closely related to diving activities. So we'll cover from skin all the way down to intestine. Other cancers, cancer issues are more about the cancer and how they affect diving. But this skin cancer it's more about how diving affects skin cancer. Skin cancer is directly related or affected by sun exposure or sunburn. Sometimes we see patients who had an old history of sun exposure, like some farmers when they were young. He became a lawyer, and then he comes to the hospital with skin cancer. This is possible. It's like an old smokers coming back to the hospital with lung cancer. It is possible. So most outdoor water sports, well including scuba or free diving, we have high risk of skin cancer. Like 11 o'clock in the morning to 3 or 4 in the afternoon, it's the worst time for the day. It's the worst time regarding the infrared sunlight. But actually that's the best time for diving, because sun comes directly from the sky, it has better visibility, and it's warmer, But this is the time you really need to focus on being very careful. Let's see. When do we apply our sunblocks? It's 30 minutes before we get exposure. We need some time for the blockers to get into our subcutaneous tissues. If you have all the history of skin problem, including cancer, then you need to be extra vigilant. You have to be very, very careful, because you are in risk group. So you have to think about the risk you get from scuba diving and the benefit from getting the scuba diving. This doesn't really say don't dive, but there is the way we talk about it is just do something else. So if you had the skin cancer before, I think it's better you stop diving, or you cover up yourself with whatever you have outside, and even underwater you need to cover up all your face, because skin cancer comes most of the time on our face. There are some cancers occurring on your lip and some other part of your face. Then if you do the surgery for them, you have a pretty bad disfigurement around your mouth here and there, and it's very hard to keep your mouthpiece in your mouth. So if you have this problem, you have to think very carefully. Simply by being able to equalize, being able to kick, being able to go down and coming up, it doesn't necessarily mean you can dive. So if you had cancer, skin cancer before, consider it very seriously. About brain cancer, I think I made another a very long presentation on this. You can dive, but have to be very careful on before you dive. So the seizure conversion after post-op is the main concern. Lung cancer. Lung cancer is directly associated with tobacco, silica, and air pollution. It goes, the lung undergoes significant pressure change while diving, and barotrauma by tumor blocking the airway can come anytime. If it happens on ascent, the blocked air can expand and give you lung overpressure, lung overexpansion injury. Can even give you arterial gas embolism. So this is something we really need to be very careful about. Cancer itself is really, really very, very malignant. So people who have lung cancer, or people who was diagnosed as having a lung cancer, they are usually very weak. It's hard to withstand the diving. When you have tumor or you have surgery on your lung, you have chemo, radiation, all these treatment modalities, the lung function goes down. So again, you'll be too weak. I'm sorry to say you. It will be too difficult for anybody to die with these disease or after treatment. Chemo for lung cancer, it has other toxic effects on other organs. So it is also another thing that we always have to consider. So if a person have lung cancer, or if a person had some modality of treatment, lung cancer is not, diving is not recommended for a lung cancer patient. Breast cancer. Cancer itself is not a problem with diving. You can dive. But the modality of treatment and the side effect of the treatment is the main concern. We have to wait for the wound to heal up completely. Because if you have a wound and you get wet in seawater, the secondary infection can come anytime. Also, breast cancer chemotherapy and radiation is very toxic to lung, as we talked about many times so far, and that's one thing we have to consider. Chemo can give you nervous system or psychiatric side effects. So after chemo and radiation, we need to assess our body thoroughly before we decide if we're going to dive or not. Many patients after surgery for breast cancer, what do you call it? Mammectomy? Sorry. They put implants. Saline is nutribuoyant. It's water, you know. Or some people use silicone, which is negatively buoyant. But these have no problem with diving. So you can dive after breast implants. But still, in all breast cancer or breast cancer treatment, pre-diving full checkup is mandatory. We have a lymphatic and hematologic cancer, and what about them with diving? We have a disease called malignant lymphoma, leukemia, sickle cell, anemia, thrombocytopenia. These are all lymphatic and or blood cancers. These affect our immune system. So we become very susceptible to secondary or primary infection. Also, these disease or cancers will give us anemia, low hemoglobin level. We can faint because of that, or blood cannot clot appropriately. So these can give us lots of problem. So you may dive, but you really need careful checkup and decide. So let your doctor decide if you can dive. There are some cancers occurring on our bone. Osteogenic sarcoma, a very, very malignant cancer. These disease and the surgery becomes very extensive. And also it debilitates us. So make it very hard to participate in diving activity if you have the disease and if you have conventional surgical treatment for these. Men's problem, prostate. I have seen some prostate cancer patient still diving with no problem. I really wonder how they are doing now. But for prostate cancer patient, we need to consider the extent of treatment. It's about if we did any surgical removal of the cancer and surrounding tissue, that's something that we have to be very careful about. Also, if we did surgery, wound have to be very clean with no infection. And how is the general condition of the patient? And after cancer or after cancer treatment, what's his level of fitness? So prostate cancer, we don't really recommend them not to dive. Gastrointestinal tumor comes next. If you have a gastric cancer, stomach cancer, if you have some problem in your small intestine, they're usually okay to dive. Oh, I'm sorry. Upper GI usually okay. They can come back to diving post-operatively. But lower GI, colon, rectum, anus, in very many cases, they do live with their colostomy bag outside their body. They make artificial anus on their skin. It is okay to dive with this colostomy bag. It's okay. What you have to mind is the infection of the artificial anus, and also we have to think about the buddies. We have to live and dive with the smell. Buddies needs to be patient and cooperative. I hope if we ever have a chance to meet these people, please be ready to help them. Diving must be the only pleasure they have. So, so far we talked about cancer and diving. We talked about what cancer is, and skin, brain, lung, breast, lymphatics, bone, prostate, and intestine. Usually bone cancers make it impossible for you to dive, just like lung cancer. Otherwise, make sure you go to your doctor and do the full checkup on the function of your lungs, on general health, before you decide to dive. And I hope you have a very, very good time in diving and life. And thank you very much for listening. This was about the cancer and diving. And I'll see you soon.